Good afternoon. I'm so happy to be here. I'm here to talk about pretty much body mechanics and workstation ergonomics as it relates to your spine. And I know we said back, but we need to kind of take a look at the entire thing, that it's not just the back, you're thinking your neck as well, when we're thinking about body mechanics and proper movement. Now, in your business, you have folks who are working in the office setting, and then you have people who are working in the sales and who's working in the warehouse. And so throughout all those areas, you're working your back in different ways. You know, the misconception out there is that, oh, well, you know, obviously if I'm lifting a heavy box, I need to be good and, you know, do it the proper way. But you really should be looking at it throughout everything you do, whether you're sedentary or you're active. And, you know, at the medical group, when I do this presentation for our new hires, I let them know, yes, we want you to be safe at work, but you need to look at it past work, that you want to be safe at home so that you can do all the things that you want to do in your personal lives. So take this as not just a work thing, but just as a good practice for a healthy lifestyle. Now, I did include a couple handouts for you. So feel free to put these at your workstation. You can have it at your cubicle. I'm not sure how your workstations are set up, but you can have it as a little cheat sheet just as reminders to do stretches to keep that back health going, you know, throughout the day. So we're going to talk about these a little more detail, but these are great handouts that you can kind of keep nearby at your workstation as little cheat sheets and reminders. Now, when we're talking about good body mechanics, we're talking about maintaining the normal alignment of your spine throughout everything you do. And of course, sometimes that can be a little tricky depending on the type of work you do or the activity you're trying to do. But you want to you get the most benefit when you're trying to keep it in alignment. That's neck and back. So I brought my little spine here, you know, just in case someone wanted an extra back. No, if their back is not that great, but also just to show this is what your, minus the skin and the muscles and everything, this is what your spine looks like. And you have obviously the various bones here. You have the disc in between that allow us to move, you know, the way we do. And you have the nerves that are coming out that are going to the muscles that allow us to move. So all of these components work together so that we can be active, move our uppers, move our lowers. And when we have back issues, it's one of these components usually that is causing the problem. It can be the nerve, it can be the disc, it can be the bones themselves with arthritis. Obviously, there's the typical muscle strain that we get. You know, you go home and you're like, oh, I got to clean that garage out this weekend. You get to pulling and pushing, and then the next thing on Monday morning, you barely can get out of bed. You feel that soreness, that's muscle strain. So to try and avoid those type of injuries or setbacks, you want to keep in mind that, you know, our back needs to last us a lifetime. So as we get older, our spine is changing. You know, I'm not trying to make anyone depressed here or anything, but that our spine is ever changing. You know, we hear, oh, someone has arthritis. Oh, there's your changes you've seen on my X-ray. What that's showing, that, you know, the wear and tear of just walking on the earth, doing the things from the time we've, you know, been a child all the way into adulthood and further. So it wears and tears on the structures in our body. And that's what we have to learn to, you know, kind of do the best we can to work around that. So when we're talking good body mechanics, you have the normal curve of your neck. You know, you have a little curve here. Then you have your back, the mid back that bows out a little bit. And then you have your lumbar spine. And a lot of folks get a lot of issues here and a lot of issues here. The reason being that those two areas can move the most. You know, you can turn your head, you know, you can twist your trunk. The mid back, not so much, because your ribs are attached. So it limits the amount of turning and moving you can do. So when we have folks come into physical therapy, obviously, you know, they're coming because they're having some difficulty with their back, with their neck, and we're trying to decipher along with the physician what's going on. So, you know, we always look at what was the mechanism of injury. How did this happen? What did you do? No, that you're having this issue. So it's the what what did you do that you really need to kind of think about, yeah, what did I do that brought this on? You know, in the years I've been a physical therapist, I've worked in the hospitals, I've worked in an outpatient setting, which is what I'm doing now, nursing homes, peds to geriatrics. And in working with all the populations, you kind of have to get to the brunt. Okay, what is the person doing that's causing this problem? So as you're looking at this, you know, a patient presents or someone presents, it's like, okay, I injured my back. When you're looking at it, you want to say, okay, I was lifting a box. How were they lifting that box? Yeah, usually I don't have the patient demonstrate, but I usually ask them, did you use your legs or did you use your back? You know, and they're like, oh yeah, I used my back, just kind of bent forward. You know, they start going and it's like, yeah, you're not supposed to use your back. You know, that's the misconception out there that it's like, oh, especially when we have guys in our departments, you know, there's a lot of ladies here. We want to use them for the manual labor around here. But the misconception is that you have those big, broad back muscles, but that's what those muscles are for. That's not what those back and neck muscles are for. The whole purpose of your back and neck muscles are to hold you up against gravity. They're called postural muscles that help you stay in good posture. Muscles of your body are your leg muscles, okay? Your quads, your hamstring, your buttock muscles. That's what you're supposed to be using when you're lifting. Your broader shoulder muscles when you're trying to lift something, keep it close to your body. So that's the thing. We think someone who has a lot of muscles, like, ooh, they're really strong, and you don't have to use great body mechanics. Nope, you need to use great body mechanics, as it doesn't matter how big or small the muscles are, you can still injure yourself. All right, that makes sense, right? Now, so you have this person that, you know, that has injured their back. And so when you're looking at it from just an active person, say someone working in the warehouse, yes, you want them to use their legs. But some folks say, okay, you know, yeah, I do use my legs. So if I'm bending like right now to bend and get something, you know, if I drop my pen on the floor, you know, usually even as a therapist, I'll just go like this and I'll bend to the floor and pick up my pen. We all do it, right? Even as therapists cheat and do that. But really, whether you're picking up a pen or you're picking up a box that has, you know, reams of paper or, you know, anything, you really should be doing the exact same thing. The mechanism of injury isn't that, oh, it's a heavy box, so therefore I should use my, you know, the proper muscles. It's that if you are picking up something light and you're just bending like this, in time those structures kind of give out on you. So when you're 21 and not because you can pretty much do anything and you bounce back, right? But as time progresses in doing the wrong thing, then one day, and I've heard it so many times over the years, I was just bending down to tie my shoe. I was just bending down to pick up something I dropped. And then I heard a crack in my back or something pull or pain radiating down the leg. Have any of you guys experienced any of that? Karen in the back? Yeah. You know, and it isn't that they were lifting something heavy. It's just the mechanism of injury that you're not supposed to be using your back in that way. So you're supposed to be keeping that alignment. So when you do move, you're supposed to your knees. And did you just hear my knee crack? Yeah, happens every time I do that. But that, you know, part of it too, when my patients, my older patients, they may say, you know what, my knees aren't that great. Yeah, I get what you're saying about the body mechanics thing and using my legs, but then my knees aren't that great. So you kind of have to learn how to work with what you got type of thing. But what you're supposed to do, and my knee cracking, that's just my knee cracking. It's not, doesn't hurt. I don't have any major issues with my knees, but our bones make little noises here and there. That shouldn't deter you, you know, bending. So I'm trying to keep my back straight. I'm reaching for that box. I'm reaching down for that pen. So I want to use these muscles, okay? Hopefully I'm not messing with the sound too much with my bending. So when you're bending forward, you're just putting a lot of pressure, a lot of strain on those structures, and then one day they just kind of give out on you. So you want to totally avoid it altogether. That makes sense, right? You got to think of the mechanics of it. And so, okay, so that's lifting, you know, something from the floor, whether it's light or whether it's heavy. A thing that you may want to do when you're going to lift something is check the load. You know, sometimes you see a box and you make an assumption that, oh, it's probably heavy, and it could be a light box. It's just a, you know, just a box, has some light things in it, fluffy stuff in it, and you just pick it up, no problem, one person. But it could be a smaller box, but it might be really heavy. So you want to check the load before you actually go for it, and make sure that what you're picking up is something that you can actually handle on your own. And obviously it's like, ooh, no, I'm going to need some help. You need to get help. You know, everyone gets busy and has their job to do during the day, but we want to avoid injury, right? So you've got to kind of help each other out and work as that team to kind of say, okay, I need to get this done. You know, you may go to your coworker and say, hey, can you help me? And they're like, oh, I'm in the middle of something. It's like, oh, when you're done, can you grab me and we can do it? You know, just kind of work together in that way, so that everyone stays safe. So now you've got some help to help you with those heavy boxes. You want to keep your legs far apart. You have a better base of support when your legs are not together, okay, like this versus like this, okay? You get the optimum work of the muscles going versus like this, okay, because then you're easier to lose your balance. So you want that wider base of stance when you're going to that load, okay? So keep that in mind as well. So as you're moving forward and you're trying to lift that box, or you're kind of looking at, oh, how did I injure myself? A lot of times patients are just bending at their back. You know, that's a huge one. So if you cut that out, you're already really getting everything back on track by just limiting the chance of getting an injury. All right, now what can happen sometimes as well, it's like, okay, yeah, I can get that if I just bend, move use my knees, keep my back straight, makes sense, tighten my tummy as I do it. You know, always hear, tighten your tummy, because that helps to stabilize your spine when you tighten your tummy. And when I say tighten your tummy, I'm not saying hold your breath. Okay, you're just tucking in your tummy a little bit and then bracing yourself and you bend. Okay, so when you hold your breath, and when we're teaching patients, that's their first thing. They want to suck in their tummy and hold their breath. It's like, okay, you should still be able to breathe and do the exercise. So, we just cue them on that. But you're just tightening your tummy, which braces your back a little more, and you lift. Okay, now, it's always those kind of tricky situations like getting something out of a car or a truck, where obviously you kind of have to bend in. If I'm getting something, I have stuff in the back of my trunk, I'm not really tall, so it's not like I can really still bend and have space to get over into the trunk. So sometimes what you have to do is bring the load closer to you and then lift it. So if you have that box in the car, you want to make sure you bring it all the way as close as possible to you, okay, before you lift it out of the trunk. It's going to be a little tricky because you're still going to have to kind of bend maybe a little bit, but you're not bending like this and pulling it out of the trunk in one fatal swoop. So you want to bring that box closer, okay, get the knees bent a little bit, maybe even kind of against the car fender a little bit, and then you just lift it, and there you go, and you take it where you need to go. Another thing that patients get injured with, or can get injured with, is the movement of once you pick something up, they swing their trunk with the load. So, and you don't even think about it. You just kind of get up and go. But then when we go through this for our nursing compliance fairs, we do these biomechanics reviews, and I have to make them demonstrate lifting a box, from the table to the floor, that type of thing, for me to sign off that they went through my station. And so when they do that, they're so quick. They're like, okay, I got the whole bend the knee, get down low. But then they take off and they rotate their trunk with the box. And if that's a heavy box and you rotate like that, again, you're moving out the alignment, the normal alignment. Now you're rotating. You're asking for a back strain or something else to happen. So you want to remember to move your feet. The load should be next to you. You hold that box right next to you, and then you're moving your feet, and then you put it down on the table. You don't swing it onto the table. All right. So you don't even realize this sometimes because you're just so, okay, let me go. And you want to make sure, a lot of this is just thinking before you act and not just taking off because I need to get this done. So that's a crucial one, that people twist with a heavy load, and you're asking for trouble there. Okay. So that's lifting. Now, because, most of us are on computers in one shape or form or another, in healthcare now, we're on the electronic medical record. So, for me, in the last couple of years in my department, it's physical therapy specifically, we went from paper to being on the computer more. So it's not just, to check an email. It's like I'm treating a patient and I'm on the computer, checking emails, I'm on a computer, so physicians, everybody in the company is now on computer. So with that, there's some inherent risk there when you're on the computer a lot. So that's where it comes into play with the workstation ergonomics, having that right chair, the computer setup, all of those things play a part because we think again that, I have a more sedentary job. It's not a big issue for me. It is a big issue. Our spine is not meant to sit all day, so we're already putting our back in a compromised position just for the work we have to do, which is sitting at a computer and inputting data or emails or reports and all those things. So the first thing that all of you need to do and incorporate into your day-to-day is getting up and stretching your back. So if you're sitting for most of your day, you shouldn't be sitting and barely get up for a bathroom break and then it's lunchtime. You need to get up periodically and just stand up and stretch. Okay, and you see I'm going backwards. I'm not doing, toe touches and calisthenics that way because again, that's bending forward. That's not a good thing. So what you want to do the opposite of what you've been doing all day, which is sitting. So you need to extend your spine. When you think about all the things we do in the sitting position, we eat, work, TV, movies. That's a lot of sitting. And then the rest driving. And so everything that we do is sitting. And when we lay down, it's to go to bed. And for most of us, we probably don't get enough of that, as far as sleeping a lot of hours. So a lot of what we do is in the sitting position. And so it makes sense as to why we have these issues. So you want to throughout your day is to break up that sitting by just periodically just standing and just do like 3 to 5 times, just bending backwards. Okay, let me kind of get the side view going. And you're just bending back like that. Okay. We know when we sit, whether we're in a chair or unsupported, like on a stool or something, in time, if you're there, what happens? You sit up nice and tall, but as time goes on, what happens? You start slouching, right? No matter what you do. I mean, I don't care if you're the strongest of strong, your muscles are going to fatigue. And that's your body telling you that, okay, you've been sitting for a little while, you might want to get up and take a little break. It's your body talking to you, and we need to listen. Yes, we have work we need to do. Yes, we have deadlines to meet, but, we want you safe. We want you to be able to come back to work the next day. So you need to take those breaks. So even if you just stand up and do just a couple reps going into extension, we call this extension, and then you sit down again, then those muscles are kind of ready to go again. So, when we get tired and we start feeling that fatigue in our neck, shoulder area, what do? We start, my shoulders, my neck, you start doing that already. So you just need to do it not when you feel that, it's tightening up on me. You need to do it when, just throughout the day, just kind of as a precaution so that by the end of the day, you're not feeling as tight and sore. So that's why we have our easy office stretches. I'm back to this handout. So you have your easy office stretches. And we have here for the neck, for the hands, for the wrists, upper back, and shoulders. So it's showing you different things just to kind of break up moving, the neck, turning that head, turning from side to side. Sometimes you don't even realize when we talk about posture, we talk about it a lot with the back, but even for the neck, that's a huge thing I get these days for young people. Because we're on the computer and the iPad and all these things, they kind of get you here. They get these strains in their neck and they're just like, I don't understand why I'm having this neck pain and now I'm having symptoms into my arm. And when they're sitting talking to me, like this. And I'm like, that's why. Because you need to sit up straight. So I just usually kind of push their shoulder back and they're like, oh, okay, yeah. Yeah, I guess I do slouch. Yes, I guess I do kind of protrude my head out forward. And so what I usually tell them, I said, you got to do, I don't want you doing the turkey thing where you're out like this, okay? I want where you're doing the turkey thing where you're kind of coming back like that, where you get the whole turkey neck going. So you want to do what we call chin tucks. Okay, you know, when you're on the computer, and you see I wear glasses, but sometimes I don't wear them all the time. So I'll be on the computer and then I'm like, oh, what does that email say? Oh, what is that? You know, I'm doing the forward head posture. That's what we call it, forward head posture. And again, it's not working in the proper alignment. You're getting yourself out here, and those muscles that are connected right here, they're getting pulled. And see, she's like, oh, let me stretch as I go. So you need to key into that. You want to keep that alignment. If as you're sitting, you notice that you're starting to fatigue, you need to stop for a moment, do some shoulder rolls, turn your neck. You know, you can do a little side. Like my friend over here, she went a little further. She took a little, pull the head and turn, you know, so you can add little combinations to it to get a little more of a stretch. But again, you want to stretch. Okay, that just breaks up that tension, and then you're kind of ready to get going again. Okay, so really take these things back to your workstation. Now they show the gentleman here with the lower back. He's sitting and doing the side stretches in the sitting position. The trunk rotation stretch, it's good as a stretch. It's not good while you're lifting. Okay, so you can do that using your chairs of fulcrum to pivot, and then the last one where he's standing and actually stretching into extension. Okay. And I'll touch a little bit on the eye strain, since it is here. You know, like I said, we're on the computer a lot, so you do need to take those eye breaks. You know, sometimes especially if you're working on a report or something where you're a lot of numbers, a lot of, you know, data, you're just, after a while it starts getting a little fuzzy there because your eyes are getting tired. So you need to just, okay, let me just stop, take a break, close my eyes, open my eyes, you know, step away, you know, and give your eyes a rest too, you know. So I'm going to give my plug for eye care as well. All right. Now on the computer fit, the blue one here. All right. So we have our person sitting at their workstation. All right. And so when you think about your workstation that you're sitting at now, or even if your workstation at home, because we all have our home offices now, right? You know, laptops and PCs at home. So this definitely can translate for home as well, that you need to have a really good ergonomic setup at home and at work. And it all starts with the chair, you know, so like this person in the picture, they have a chair that doesn't have armrests. And obviously that can be optional depending on the person. But, you know, I really go more towards having an armrest so that you can actually rest your arms. And the purpose of that is that, of course, if you're having to hold your arms up, what are you doing? You're using this muscle right here to hold it up. And if you're doing that for 8 hours or even longer in a day, that can get really, really sore. So having that arm rest just lets you rest your arms, not as much tension on the shoulders, and you can key. Okay? Now, another thing you notice with the chair is that you want where you're sitting at almost like a 90-90 as far as at the hip in relation to the back. You don't want where the chair is too high, where your feet are dangling and swinging. All righty. You don't want it where it's too low, where you're flexing too much at your hips, because then again that can put a strain on your low back. So it can be a little bit of a challenge with the chairs sometimes, but you want where you're able to, your feet hit the floor. Now for more petite folks, obviously even if you have the back at the nice 90-90, your feet still may swing. So what you have to do, and you can find this at any office, I don't know what you guys use as far as your office supplies, but Office Depot, Staples, any of those type companies, you have what we call the foot rest. You know, you may have seen them where it's a little, almost like a little mini stool that you put down, and it can usually rotate a little bit. You need to always have your foot resting on something, because when it's dangling, it puts a stress on your back. And just winging your feet around the back or the leg of the chair, that's not a good thing either. So you want your feet actually planted on the floor. All right, so if you need to add a footrest or something there, definitely talk to your supervisor about that. Now, so you have your chair, so that kind of starts off the whole thing. Now, as far as with the actual desk itself and with the keyboard, you know, some folks prefer an, you know, pull out under the counter keyboard. Some, you know, have it on the desktop. You know, it's more of a preference thing. For comfort, you don't want where if it's on top of the desk that obviously you're having to lift your arms a lot and that type of thing to key. You want where your arms stay relaxed. So if the under pull out, you know, keyboard works better for you to keep your arm relaxed, then go for it. Take a look at getting that done. And then also you notice next to the keyboard they have the little, it's a little rectangle like square that's supposed to be like the wrist gel pad, you know. So then again, we've all heard of carpal tunnel, right? You know, where you start getting those symptoms into the hand, the numbness and tingling, because that nerve gets trapped in what we call the carpal tunnel. And so you don't want where you're having to, you know, have exaggerated movements at your wrist where you're cranked like this or you're cranked like that. You don't want the extremes. You want to be more in that mid-range. And sometimes just having that wrist gel pad allows you to do that, because then you're not sinking so low. It keeps you at a nice neutral position. So yeah, take a look at, and of course it's soft, so it's not putting a lot of pressure on there where it's just like, oh, this is hard. If you have one, you know, it's usually pretty comfortable. And if you've never tried one, you should give it a try. If one of your, you know, co-workers has one, to give it a try and see if that's something you would like, because it definitely makes a difference for just wrist comfort and decreasing that chance of any carpal tunnel issues kicking in. Now, so you have your keyboard and you now have your monitor, and this is where some people get in trouble with the monitor, because you want to make sure obviously that it's straight away. You know, some folks, depending on how the desk is set up, you know, you may say, oh, let me put my computer in the little corner here so I can have more space on my desk. But the issue is that you need, when you're working on that computer, to be able to face it straight on and not where you're kind of turning one way or turning another to access the monitor. Because again, you're working one muscle group more than the other, you're going to start feeling it. Okay, so you need it to be straight on, and just try and find that setup where you can have the workspace and still have that monitor on. Now, looking at the monitor height, obviously you want to make sure that you're not looking up or you're looking down. You need to be here. So, you know, one way to test it out is to try reams of paper to kind of gauge a height that works for you before you actually buy something. If you're not quite sure what to get as far as adjustable height on the monitor stand. So you can always test it out with reams of paper, but I wouldn't say stay with the reams of paper. You want to actually get a monitor stand that's adjustable to the height that you need. Alrighty, so usually when we try folks out, we'll say, okay, let's do one ream of paper, let's do two, just to kind of gauge, and it's like, oh no, this type of stand would work better for you versus this type of stand. So keep that in mind as well. That all makes sense, right? So this is a nice, good cheat sheet, especially if you have new employees coming into the company. They're taking over a workstation of somebody else that worked here. You know, that chair might not work for them. The monitor height may not work for them. So you may have to get with that employee and say, okay, how do you usually work at your station, you know, in your previous job? And it's like, okay, usually I have like a under desk keyboard. I usually would have the computer over here, and you need to try and make it work for them in their new work setting. So this is kind of a good cheat sheet to use when you're assessing someone for their new workstation as well. Okay, so keep that in mind. And of course, like we talked about, you know, you have to take the break. So very, very big on taking the breaks throughout the day, just to give your eyes, your shoulders, your back, all those structures that we're just using like crazy, a chance to recover and kind of be able to carry you through the rest of the day.